often should you go to the dentist? It's a question many of you may have pondered, and the answer is not one size fits all. So today we're going to dive into the 5 factors that can help you determine the right dental schedule for you. My name is Charlotte, and you are watching Burst TV. Okay, factor number 1 is the current today's state of your mouth. Your dental team is using all of their senses, all the technology and conversations with you to figure this out. So if you have excellent oral health with no issues or concerns, your recommended dental visits may differ greatly from someone that's dealing with ongoing dental problems. For you, the standard twice-a-year approach could be great, but it's a different story for an incredibly high percentage of people that have bleeding gums, for instance. Bleeding gums that are lightly touched by an instrument, let's say. Bleeding gums are a sign of an infection and a major red flag that something's just not right. So it's important to stop and assess why it's happening. Okay, this is my favorite demonstration to help with that point. Scratch the top of your hands with your fingernails. Scratch your eyelids. Sit back and look. Hopefully there's no bleeding, right? Because they're healthy. And please trust me, if any body part starts to bleed, you would probably run to the hospital. But because gingivitis is so incredibly common, people simply get used to it or have a sense that they brush too hard, floss too aggressively, or that the dental pokey instruments have caused the bleeding. Anyway, regular checkups and visits with the hygienist help maintain oral health, but the frequency of that visit could vary depending on your mouth's condition. Okay, factor number 2 is your dental history. So your past experiences with treatments, procedures, they're going to play a significant role. If you've had a history of cavities or gum disease or other oral problems, there are so many, your dentist might suggest more frequent visits. This is because technically decay is a disease process and very much dependent on the bacteria in your mouth. So once you have a history, the risk for future cavities and periodontal disease is way greater. And technically, periodontal disease doesn't go away. You just get yourself to where you're stable. The bone never actually grows back. So it's important to stay really connected with your dental team. Okay, number 3 is your medical history, and this can be quite a list for you. So we understand how annoying it is that everywhere you go, every medical professional needs the same answers to the same questions. And sometimes it's hard to understand why a dentist needs to know so much about the rest of your body. But trust me, it's not because they're being nosy. The medical history includes everything from age, medications, medical conditions, as they all come into play. For instance, as we age, our dental needs do change. Certain medications and medical conditions can have a huge impact on our oral health, requiring more frequent checkups. Now, I'm creeping closer to 50 and I've noticed dry mouth for the first time ever. So keeping this in mind, I'm going to need to make some adjustments in my routine. And if my hygienist starts to see that I'm building up tartar faster, for instance, I might need to get my teeth cleaned more often. Now, that's just a personal account, but for those of you who like broad analogies, think about a brand new car versus one that's 50 years old. The older car needs to have us look under the hood more often than something that just came from the factory, right? Kind of like that. Okay, 4th on the list is your oral care habits at home. If you are meticulous about brushing and flossing and maintaining a healthy routine, you might not need to visit the dentist as frequently as someone who doesn't have those things established. Your dental team can provide guidance based on your routine and what you're good at, what you're not good at, and what you're gonna or not gonna do. Honestly, some people could easily go a year between visits and then be just fine. Don't tell your dentist I said that. Here's the thing, it's critical that when your hygienist is coaching you and asking you for your routine at home, just keep it real. If you say you're flossing every single day and they see signs of a different story, it could lead them to believe that something much worse is going on in there, or just not trust what you're saying. So the golden rule is don't lie, especially to your hygienist. Okay, number 5 is your diet. You know what they say, you are what you eat, and there's a lot of truth to that. Just check out Marissa's video where she takes us shopping for foods that help fight periodontal disease. What you eat and drink can significantly impact your oral health. A diet high in sugar and acid, for instance, may increase your risk for dental infections and decay, whereas a balanced diet can contribute to better dental health and overall health. Remember, this is all connected. So, how often do you think you should go to the dentist? It's clear there's no one-size-fits-all answer, and it's essential to consider these 5 factors: the current state of your mouth, your dental history, your medical history, your routines at home, and your diet. In fact, the American Dental Association doesn't even provide an actual frequency recommendation for teeth cleanings. They state that regular cleanings are recommended at intervals that have been determined by a dentist. Ultimately, it's you, your dentist, and your hygienist that are working together to create a personalized schedule that suits your unique needs. Remember, regular dental checkups are crucial for maintaining a healthy smile and catching issues early. And even though dental care can be expensive, staying ahead of cavities and broken teeth is way more affordable than waiting for things to fall apart. Thank you for tuning in today. If you have any questions, leave a comment. If you found this information helpful, let us know, and we'll see you next time on Burst TV.